Hi everybody, Dustin Klein here with Sun Valley at our Dunlap location with one of our 4-year patients, John, who has been gracious enough to give us some of his time to interview him about his experience with Sun Valley and using medical cannabis for the last 4 years. So first of all, John, thank you for coming and being a patient of Sun Valley for 4 years in a row. What do you think about our clinic? What's brought you back here? You know, there's a lot of deals out there, a lot of cheaper places to go. What's the reason you've kept coming back to Sun Valley?
You know, I've always just felt comfortable here. This is my first place that I've been to.
Uh-huh.
I just like familiar place,
Yeah.
comfortable staff. Everybody's super nice and friendly. This has always felt good coming back here.
I'm glad to hear that. That's what the whole idea about what we do is to strip away every piece of work and all the stress off the patient's backs and leave all of that to us and give the patient just a good experience to learn more about the plan, discuss your medical conditions with the doctor, and get your card as fast as possible. So I'm glad that you're saying what we're trying to preach out there. So 4 years in a row as a medical patient, what is the reason that you became a patient? Was it an injury, a disease, or accident?
Well, back in the late 90s, I was in a pretty bad car wreck. I had multiple surgeries, knee, nose, collar, and I started to recover from that, but then I started to get hooked on like, the pain pills and stuff.
Yep.
And I just...
Did they stop working for you? Did you have to keep increasing?
I started to become tolerant to them, so I had to keep taking more. And then the doctors were like, you need to get off of this, you're on a bad path here, you know.
Yeah.
And so I weaned myself off of those, and I just started relying on basically over-the-counter pills like Tylenol, Advil, and same effect with those, you know. The more you take them, the more you have to keep taking them.
Yep.
And more, and then it's bad for you.
It's bad.
Really
It
bad.
is a serious impact on your kidneys and liver.
Mhm.
Tylenol,
Oh,
Advil,
definitely.
things like that. They're definitely for short-term, not long-term use in general. It says it
Mhm.
right on the label.
Yep.
And so were you a consumer of cannabis then, or did you choose it as a form of relief? Or
I found it as a form of relief, and then when I was able to get a medical card, I found out it helps out so much with like, I don't even need that much of it. I basically stick to the flower side of it.
do you smoke just the flower?
Yeah, I smoke just the flower. I know there's a lot of other options and stuff,
Yeah.
but that seems to work for me.
I'm personally a flower. Probably 90% of the way I consume cannabis is flower too. It's all I need, and I prefer the flavor. It's like a fine wine or a coffee to me,
Mhm.
along with medical benefit. How do you consume? You do bongs or pipes or joints? Or?
Mostly pipes. I can't
Pipes.
roll a joint for the life of me.
Yeah. Yeah, I like small pipes myself.
Yeah,
It's
so
efficient.
I have a little tiny small pipe, and I smoke just a little bit a day, you know,
Mhm.
a little bit in the morning sometimes, and then at nighttime it helps me get to sleep. And
Yep. That's awesome. So now, 4 years into the program, having access to medical cannabis here in Arizona, where are you at with the pills and any level of opioids or over the counters? Are you still using them at all?
no, I really don't use anything else at
No?
all.
Fantastic.
That's what
That's
I'm
the
talking
best
about.
thing we can hear, man.
Mhm.
Well, I want to thank you once again so much for giving us this time, being our patient, and understanding the value we bring to the community.
I appreciate
So,
it, man.
thank you so much. This is Dustin from Sun Valley with another happy patient here, signing off. Have a good one, everyone.